Hey, it's Dr. Nuesse from EasyDOTphysicals.com, back again with another video, and this one is actually 10 years, almost 10 years in the making. So I just recently did an updated for 2024 how I perform a DOT physical, and that is based on the fact that we meaning certified medical examiners, just received an updated 2024 CME handbook that gives us regulations and guidance on how we should be evaluating drivers when they come into our offices. So I just got finished reading and kind of digesting the over 100-page document handbook and watching the webinar, and I made a whole bunch of notes here about some of the changes, clarification on certain standards, and I want to go over kind of the highlights of all of this. I will leave links to both the webinar, because this is public information, the webinar and the handbook in the description box below if you want more information. So this is mostly going to be for other certified medical examiners, although if you want some behind the scenes kind of on how we do exams and what we're looking for, feel free to watch this video in its entirety. Again, this is not going to be everything, every change. Again, I encourage anybody to read the document for themselves, but these are the things that I got from the document that really potentially might change how the exam might be performed by different providers. So, again, made a lot of notes down here. So we, the CMEs, the medical examiners, we've been without a handbook since 2015. Again, I said that this is almost 10 years in the making. And we've been with very little guidance on the regulations and what we should be doing. And what I have done, and what I know a lot of people have done, is we've just kind of pieced the information together. And we've definitely been told that we were not supposed to be using that 2015 handbook. And there was a website where some regulations were listed, but it wasn't very clear in my opinion. So we kind of pieced a lot of this together. Now we have a very clear document. So the new document, the new 2024 handbook, it has a big emphasis on individualization of assessments. So a lot less what they're calling regulations and a lot more guidance. Regulations being things that are absolutely mandatory, like the vision standard is a regulation. The hearing standard is a regulation. Then there's a lot more that is just guidance, where they make basically suggestions that are more optional to help you make a decision on if the person you're evaluating is fit to drive. All right, so in the handbook, there are a lot of things that are similar or the same. And there are a lot of things, in my opinion, from my reading and how I've been practicing over the past, I've been doing this for 10 years. There's a lot that has changed. So I want to go over a lot of the things, the high level things, the things that I think are very important that have changed, that may change the way that I actually do these exams. So first, the biggies: hearing, blood pressure evaluation, vision. These are the same basically. The standards are basically the same. So the vision video that I made several years ago, the hearing video I made several years ago, the blood pressure video that I made I think several years ago now, those are all still valid. Those standards are still the same, with one major exception, and that is now that listed in the handbook is the alternative vision standard, and I made a video about that as well. So there is a way for drivers with good vision only in one eye to still be medically cleared to drive by going through this alternative vision standard. Again, I made a video on that, but now it is actually in the medical handbook. And the other thing that is included now, as that was different from the old medical handbook, is the standard for insulin-treated diabetes for insulin-dependent diabetics. That is now in the handbook as well. Again, I've done a complete video on that too, but now there is a process where someone that takes insulin may be certified and cleared to drive. All right, and again, I've made a whole bunch of notes here. So next, we are going to go through, again, the biggies that I think have either changed or been clarified, and they are regarding heart problems, sleep apnea, a huge one, and medications, different medications that people take, and illegal drug use. All right, so starting with heart conditions, and I'll read what the old standard was right from the FMCSA website that I was told directly from the FMCSA to use. What the old standard was a person is not considered safe to drive, safe to operate a commercial motor vehicle if that person has a current clinical diagnosis of myocardial infarction, heart attack, angina, coronary insufficiency, thrombosis, or cardiovascular disease of a variety known to be accompanied by syncope, dyspnea, collapse, or congestive heart failure. And they must have an ejection fraction of 40% or greater. So that was the old standard. So this standard can be read as an absolute standard. These conditions were disqualifying. And again, in my opinion, this was a regulation, meaning not optional. So now, and again, in my opinion, much more is left up to the medical examiner. If you look over the medical examiner handbook that I'm going to link in the description box below, see page 36 of that handbook, but it does not list any definitive disqualifying cardiovascular heart conditions, even congestive heart failure. And I'll use congestive heart failure as the example here because that was the biggie that did in my office disqualify a lot of drivers. The guidance now is the individual symptomatic? Has the treatment been adequate, the treatment that they're going through? Has the patient seen a cardiologist, obviously? Does the individual have a stable LVEF? So it doesn't necessarily have to meet a certain standard, but is it stable? Is the individual compliant with the treatment that they are going through? And then based on this guidance, the medical examiner now has the option to certify a driver that would have previously, in my opinion, been automatically disqualified. So again, probably a lot of providers, a lot of offices, they're not going to change anything. But the big question is, will this change how I am going to do DOT physicals, this particular standard as far as cardiovascular conditions? And the answer is absolutely yes. I will now be able to look at an individual on a case-by-case basis and make determinations on different conditions that might have been disqualifying automatically previously. All right, and next up, this is a biggie. This is huge. A lot of drivers come in with this, the sleep apnea study, and this one has changed to a large degree in my opinion. So again, I'm looking down at my notes here. The previous guidance from, I believe, a bulletin that the FMCSA put out included sending a driver for a sleep study if the driver had a significantly high BMI, body mass index, or a large neck size. And then also it included confirming that a driver was using a CPAP if it was prescribed to them and was compliant using it by getting the data off of the machine. So now the handbook specifically states, and again, this is on page 45, the FMCSRs, meaning the regulations, do not include requirements for medical examiners to screen individuals for sleep apnea or provide requirements regarding whether to recommend an individual for a sleep study. The regulations also do not provide requirements by which to assess compliance with sleep apnea treatment. So basically, that throws those two old standards out the window. Now, certainly, a medical examiner can send someone that they feel needs to for a sleep study. They are within their rights 100% to do that if they want to do that based on what the old standards were because they feel like that is best, then they can continue to do that. But that is no longer looked at like a requirement, a regulation, nor is getting the data from the CPAP machine to confirm that the driver is actually using it. All right, and then maybe the most important thing from the handbook as it regards to sleep apnea, I guess depending on how you look at it, is there is no standard for specific waiting periods or maximum certifications. And the maximum certifications typically seen for sleep apnea previously was only up to 1 year. So again, the question is, how might this change how medical examiners do the DOT physical? Now, certainly it might change absolutely nothing in a lot of offices. Will it change how I do the DOT physical and look at drivers with sleep apnea? So yes, in certain cases, and I've thought about this, so I will still require the compliance data from the CPAP machine if a driver is prescribed a CPAP machine. I think this is very, very important. I think it is important that if you are prescribed a CPAP machine, that you use it correctly so that you do not have a potential event while you are driving. So that won't change in my opinion, although it is no longer seen as a mandatory requirement, but I still think it's the right thing to do. But what will change is, instead of limiting all drivers with sleep apnea, with a sleep apnea diagnosis, or using a CPAP machine to a 1-year certification at maximum, now on a case-by-case basis, I may certify a driver for up to 2 years. All right, so now moving on to medications, there's been some clarity in this regard as well. So I'm talking about prescription medications. Previously, the guidance, the suggestion was that antidepressants needed a clearance letter from a prescribing doctor. Now it states that this is optional and voluntary to help make a determination to certify. Specifically, and the handbook is very clear on this, drugs that need clearance letters from the prescribing doctor are controlled substances Schedule 2 through 5. Schedule 1, including marijuana at this time, are still disqualifying. So will this change how I evaluate drivers? This certainly will. So what I used to do is, anytime anybody was on an antidepressant, psychiatric medication, I would always require that they get a clearance letter for that medication from their prescribing doctor. Now it is only mandated if they are on a controlled substance, specifically Schedule 2 through 5 drugs. So now I can evaluate an individual, again, on a case-by-case basis and make a determination on if I feel like I need that letter or potentially not. All right, and finally, and again, these are things that I feel are most important after reading the new handbook a couple of times and watching the webinar. Finally, what I feel is very, very important and has been clarified is the standard on illicit drug use, meaning illegal drug use. So there is still no testing. So the standard DOT physical still does not require drug testing. Now, if you're getting a CDL, you will have to be drug tested, but that is done separately from the standard DOT physical. A big change or clarification is that methadone, if you're taking methadone, is not disqualifying, and it was listed as being disqualifying again previously. So that is a big change. Again, we are free, the medical examiner is free to make a determination if somebody is taking methadone on a case-by-case basis. And the FMCSA also does not include mandatory waiting periods prior to medical certification after known or disclosed illicit drug use. And this basically means that if you check that you have used a drug in the past, you've used marijuana in the past, or you've used methamphetamines in the past, or whatever, if you've used a drug in the past, an illegal drug, and you check that box on your intake paperwork, on your form, we don't automatically have to wait a certain period of time before we can certify you. We can make that determination on a case-by-case basis. But it is also stated directly in the handbook that medical examiners are not prohibited from requesting a drug test for individuals who disclose illicit or illegal drug use. So again, if you check that you have used in the past, even in the past, an illegal or illicit drug, then the medical examiner is within their right to request a drug test. So that is a real high level. The things that I thought were most important after reading through the medical examiner's handbook and watching the webinar: changes, clarifications to the 2024 Certified Medical Examiner's Handbook from the FMCSA. I would love to answer any questions if I can. Leave those in the comments section down below. Again, I have links to the handbook and the webinar, again, in the description box. Until next time, everybody, stay safe.